Kia ora koutou, welcome to eHealth Talk NZ. I'm Rebecca Macbeth, I'm the media editor at HINZ, and today's episode is sponsored by Personify Care. I'm joined by Matt Devonald. He's the Patient Services Manager at Forte Health Private Hospital in Ōtautahi, Christchurch. So welcome on the show, Matt. To start off, can you just tell us a bit about your role at Forte Health and what kind of services the hospital provides?
Kia ora, Rebecca, and thank you very much for having me on the podcast today. Look, as you said, my role is I'm the Patient Services Manager at Forte Health. So my team looks after everything that happens for the patient from the time that they leave the specialist rooms to the time that they arrive in the admission suite here at the hospital. So I like to think that we prepare patients for a successful outcome at the hospital. So Forte is a private hospital based here in Ōtautahi in Christchurch, and we're a short stay private hospital. So we specialise in gynae work, orthopaedics, ORL, dental, and urology, and a few other minor specialities as well. And so most of our patients stay with us for the day. We do a few one-night stays and the occasional two-night stay as well.
Great. And so what was the main problem or challenge that you were looking to solve when you went to look for a digital patient pathway solution?
When I first started at Forte, the hospital was heavily paper focused. Systems had been put in place that relied on your traditional patient file that was cardboard and nice A4 sheets of paper that followed the patient around in their journey throughout the hospital. And so what that meant was that the patient services team had to send out patient information packs to patients and get them to actually fill out a physical piece of paper and then either post or bring the paperwork back to the hospital, ideally 5 to 10 days before their surgery. So you can imagine what that was like. The team spent a huge amount of time chasing paper. So calling patients and the interactions where have you received your paperwork? Yes. Have you filled it out? No. Can you please fill it out? Okay. And can you get it back to us? Don't post it now because you're coming in 2 days' time. Or, worst case scenario, if you'd ring people and say, have you filled out your forms? They'd say yes. And they'd say, we posted it to you, and they were coming the next day. And so we're constantly chasing paper, and that has a flow-on effect to the whole patient journey throughout the hospital. So if the patient services team don't get the information in a timely fashion, the pre-admissions nurses can't pre-assess the patients for their suitability to come to the hospital to make sure that they're safe when they're here. Then the anaesthetists can't see records, and the surgeons can't see records, and there's a whole flow-on effect.
So what was the process in terms of choosing a partner, and how did you decide that Personify was the right one for this project? Did something stand out about their approach or platform?
So we reviewed a number of different digital onboarding platforms. Some of them would have meant that we would have to change our current patient management system. So those were ruled out as, we were not at that space at that particular time. And when we came to Personify, we found that it was an organization that actually specialized in digital onboarding for medical facilities. Their processes made it easy, and they were easy to deal with the initial discussions that we had with Personify. And one thing that stood out with me is that they were quite prepared to give us contacts of organisations within New Zealand that were already using their system and give us a point of contact so we could actually go and speak to people that were using Personify already and see what their experience had been like. There were no secrets and no skeletons in the closet that they were trying to hide. And so that was a huge part in the decision-making process. They were very cost effective as well for the service that they provided. So they provided what I considered to be good value for money, which is always a huge consideration when you're looking at a digitisation or any project in an organisation you're working for. And fundamentally, they actually wanted to help. So they were proactive in coming back to us with questions that they had of us, and they were really responsive to questions that we had of them. So during that whole discovery phase, they didn't put up any barriers, and they didn't make it difficult. So that in the end was why we chose Personify, and we haven't regretted it.
That's how you chose the partner, but internally, how did you gain leadership and clinical buy-in from your staff to proceed, and who led the project internally?
I led the project internally, and so I had to be really mindful of when I was asked to lead the project. I had to be, very conscious of the fact that change in a health perspective traditionally is quite a difficult process to go through. So it was really important for me that whilst we had the discovery phase with Personify itself, we had a discovery phase internally. So there was a lot of discussions that went on with the clinical teams as to what sort of information they needed, even though the project directly wasn't going to impact the digital teams as far as their workflows were concerned. It did have an impact on the fact that the information was going to come to the hospital in a more timely fashion, in a way that was more easily understood. So I had to get an understanding of what they actually wanted from any platform. As far as the support staff and the administration staff were concerned, that was an easier sell, for want of a better way of putting it. It was actually understanding what they needed from a digital system. There were things that we had within the current sort of manual system that were really good that we didn't want to lose with the digital system. So it was finding a way to incorporate those ideas into the new platform, and it was really important to keep people informed along the way. And we have a number of medical specialists that refer patients to the hospital, and so they needed to be part of the process as well, because they were going to be the front end of the patient journey, and as far as that they were going to invite patients onto the platform. So we couldn't look at any system without involving those partners as well. And it was a matter of showing the ideas, showing the benefits, also acknowledging that there were some questions and some anxiety out there with regards to putting something new in, and reassuring people that everybody's input was valid. And so if there was a better way of doing something within the platform, that we would consider all those ideas. So it was a really cool project to be part of, because there was a lot of collaboration across a number of different specialities, clinical, non-clinical, and inside and outside the hospital as well.
That change process is so important, but not always well invested in or thought out. So it's good to hear that you really put a lot of effort into that. So can you just walk us through what was the patient onboarding process prior to this, and what does it look like now that it's digital?
So the patient onboarding process prior to this was that obviously patients were seen by specialists in their rooms, and then we relied on the specialist PAs or the nursing staff to actually physically give a patient information pack to a patient whilst they're at the clinic rooms, or more often than not, they were posting a physical pack to the patient. So that relied on the rooms actually having to, one, pay for postage to get things out to the patient, or have the ability to have patients fill out forms within their rooms as well, so taking up space for them. So once the patient received the patient information pack, there were 5 or 6 pieces of information that we required from them, which involved a health questionnaire, a registration form, things like what medications they're taking, how they wanted to fund the process, when to present, when to start fasting, all those sorts of things, which made the pack. The pack was large, and there was a lot of information contained within that pack. So it relied on people being able to read all that information and assimilate all that information basically at the same time. And so once the patient had filled out those forms, they had to get them back to us. So that either meant physically bringing the paperwork back into the hospital, or, as I said before, posting the forms back to us. So people are people, and they leave things to the last minute. So ideally, we could say on a piece of paper that we wanted the forms 10 days before surgery. We were finding that on average we were getting most of our paperwork, within that last week prior to surgery, or in some cases the day before or the day of surgery, which made things really challenging for the especially the pre-admissions nurses to be able to assess those patients. And it made the interactions of the patient services team with the patients, that they were getting numerous phone calls just chasing paper, and those weren't effective bits of communication. All that the patient heard was, please fill out your forms, get your form to us. There was no, how are you feeling, do you have any questions? It was solely focused on actually getting the forms. So now that we've got a digital platform, whilst acknowledging that there will always be people that will want to fill out paper, and that's fine. But now have a digital platform where the process for the rooms is really easy. They have 7 questions on a portal that they have to fill out, and they invite the patient to join the onboarding platform. The patient receives an invitation, they register, and then they get a welcome pack, which includes a video of a walkthrough of what to expect when they get to the hospital, because we acknowledge that not everybody wants to read things. Some people are really visual learners, so we had that opportunity with the digital platform, which we've done in Te Reo English and in sign language. And then we ask them to fill out those 5 or 6 pieces of information that we need. Generally, once somebody registers, they fill out all that paperwork within 24 hours of registering. And then we have a number of touch points that are predicated on a person's surgery date. So we're staggering the information that we give to the patient. So we make it, it goes out at a more appropriate time. So it's no point in sending people a reminder to register their car for parking when they arrive a month before the procedure. We send that out the day before. There's no point in asking somebody if they've been unwell 2 weeks before they come. So we ask them how they're feeling, 5 days before they arrive, and we have a number of different activities that the patient will receive. Some will require some interaction, some will just require some reading. Another really fantastic function that we have with Personify is that we can set some flags with our admissions criteria, so that the pre-admissions staff will see a red flag if somebody's ticked a particular, if they say they've got congestive heart failure, for example, that will be flagged. And so that enables the pre-admissions team to be more targeted with, if a set of questionnaires comes through and everything's green, there's no flags, they can have a very quick check of that, make sure everything's okay, and then move on and concentrate on those patients that have higher acuity and higher needs. And it's meant that the interactions that both the pre-admissions team and the patient services team have with the patients is actually really targeted. Instead of ringing up and chasing forms, the patient services team will ring the day before and go, you will have received all your information. We'd like you to report at such and such a time. You've received your fasting instructions. Have you got any questions? Have you got any concerns? Those sorts of conversations, as opposed to, have you filled out your forms? And so the feedback that we're finding from patients is that they feel more confident when they're coming into the hospital, and they feel less anxious about forms and paperwork and payment and things like that. So in a nutshell, that's the process that we were at and that we're at now.
Great, yeah. Not having anxiety when you're heading into hospital for a surgery, I'm sure it has all sorts of roll-on benefits as well. You mentioned before, that some of the solutions you looked at did mean that you would have had to change your patient management system. So how easy was it to integrate Personify with your existing systems?
That has been a challenge. Unfortunately, we have a system that won't directly integrate with Personify, but because the quality of the information that we're getting through the platform is so much better than a handwritten form, the patient services team have gained efficiencies there by being able to, if they have to, copy and paste from one system to another, or just directly download forms from Personify into our clinical workstations and things like that. So that whilst it doesn't integrate traditionally, as you would say, we've got processes in place that make it work. And again, the feedback from the team is that obviously when any system is new, the transition means that processes can be a little bit slower than what you would like. But as the team have become more confident with using the platform, then we've gained the efficiency of transferring information from one platform to another.
When did you go live?
So we went live on the 1st of July this year, and we had a number of options. We could have just done a hard cutoff and put everybody on the platform at once. And what we decided to do was we decided to do a staged rollout. So we launched with 2 specialist rooms, one of our biggest rooms, which was urology associates, and one of our smaller rooms, which was a hand and wrist rooms. And so we launched with those 2, and they were sort of our live guinea pigs, for want of a better way of doing things. And then we've sort of onboarded regularly since then with a plan to have all our medical specialist rooms onboarded by the middle of January next year. I'm really pleased to let you know that as of this morning, we'll have everybody onboarded by the end of next week. So we'll be about 8 weeks ahead of schedule, which is a testament, I think, to the ease of use of the platform. So training medical specialist rooms to use the platform has been really easy. Nearly 1,300 patients have gone through the platform since we've gone live. Bearing in mind that for the majority of that time, we only had 5 rooms on board. We've had over 130,000 interactions with patients, whether that's just them simply answering a question on a form or reading something. 13,000, patient packs have been completed, and we're sitting at a conversion rate of about 89%. So I love stats and stuff like that, but that means that of the people that have been invited to the platform, basically 90% of the people who've been invited have converted their invitation to registrations and completed everything. So that's a really high benchmark to sit at with a platform that's really new. For us, it's going really, really well. And loads of positive feedback from the medical specialist rooms, because they are the front end of it. We rely on them to be able to invite the patients. They're going from kids where parents are filling out the forms for them right through to 80, 90-year-olds who are filling out their forms as well. So some of that anxiety that the organisation had about it'll be too complicated for elderly people to use, that's just been proven to be a myth. So onboarding's gone really well.
Impressive. I'm a fan of facts and figures too, so thanks for that. Which actually brings me to the next question, because I understand Forte Health is New Zealand's first net carbon zero hospital. So I was just wondering, was sustainability one of the motivators for this change? And what impact have you seen in terms of reducing paper use and waste?
Sustainability is a huge part of the whole digitisation project, because we're wedded to paper. So with that came either the actual physical paper of the books, the printing of them, the transport of them, the postage, all of the sorts of things that are associated with having a physical piece of paper that you have to get somebody to interact with. The hope for us was we were printing on average 6,000 information books a year. Our benchmark for success is about 80% of our patients coming through digitally. We'll be able to get a much better gauge of that now that we've got all of the rooms on board, and as we move forward into next year, we'll get a better gauge of it. But I timed the initial rollout to coincide with having to reorder some patient information books. I took a gamble and I only ordered 2,000 books, which seemed really small and a bit of a nail biting thing. Am I going to run out in a month and things like that? That was in July. We haven't touched them yet. So the projected savings are going to be huge for us. Yes, there are still some printing costs that we will incur, but we're spending tens of thousands of dollars on printing a year. We won't have to do that. So the impact for that from a sustainable point of view is that we're not generating paper. Things are much easier to use digitally. That means we're also not printing paper in-house as much. So all of the associated waste with that will be reduced. And so that's something that we're going to probably the end of January, after we've had 6 months of being live, we'll do some figures and see how much we've actually saved over the past 6 months. But I'm really confident that it's going to be dramatic.
Great. We'll look forward to getting those results. So you've talked about, there's obviously been great uptake. So patients have responded well to the new experience. Have there been any surprises in their feedback, or which particular patients seem most keen?
I think the thing I like about Personify is that it's an evolving platform. So we've had some really great feedback from patients regarding Personify. We've had one or two people who haven't liked it, and that's fine. But what we've taken from the people that maybe haven't liked it as much as the people who have liked it is that there's been some opportunities to tweak the platform and hopefully make it more user-friendly. One of the things that we didn't know before we went live was how the system of reminders was going to impact our patients. Some of the feedback was that there were too many reminders. And so we've been able to go in and tweak the system and halve the number of reminders that we send out to patients to either fill in forms or yes, you've got something that we want you to read. And that's had a positive impact because we haven't seen the feedback to say that there are too many reminders since we've done that. So that's a really positive surprise, I suppose, from dealing with the platform, is that we've been able to be really responsive to what patients are telling us that they need. The other really good thing from my point of view is that Personify has been so responsive to our needs once we've gone live. So it wasn't a case of, right, you're live, you're on your own. They've got a really great team at the end of the chat function, and they respond, generally within the hour for things. If it's more urgent, then you can email. They'll make pretty major changes to the platform for us, and again, it just happens seamlessly, which is, you just don't tend to get a lot of that in this day and age with people. There's sometimes you have to jump through hoops, and Personify's made it really easy. I suppose one of the challenges has been just reassuring medical specialists that the information is accurate, and as far as that's concerned, nothing has changed. The forms for them look the same. Once the forms come out the other end through Personify, they look like our old forms. They're just typed. That's been a really good thing for the specialists as well, but it has been a bit surprising seeing how worried they were about how the information would look. But no, it's all in all, I can say that it's one of the best projects that I've been involved with. So it's been great.
You just mentioned the staff some of them were feeling a bit anxious. Was there a lot of training or support required for them to go digital, and how have they responded to the change overall?
I suppose hindsight is a really wonderful thing, and for me, being the project lead and the person that took on a lot of the design and development of the project with Personify, I just thought it was easy. Hindsight is that needed to give some staff a little bit more time than others to get used to the platform. The fact that we were running two systems concurrently did make things a little bit more challenging, and as far as we still had the paperwork system that we're trying to phase out, and we're trying to go digital. So the impact of that didn't become apparent until we had more specialists on board. So it did mean that we needed to spend a little bit more time on training than I thought we did. Again, investment in training is never a bad thing. And the fact that we had the confidence to pause the rollout when we found that some staff were getting a little bit overwhelmed, it was, we sat down as a project team, discussed it, thought, right, okay, the benefit of pausing for 4 weeks far outweighs the cost of pushing it through and not getting it right. So we used that 4 weeks just to provide some additional one-on-one training with some of the members of the team that were feeling less confident, and just allowing them a bit of time to be able to interact with the system, see that it was a much better way of working than we had done in the past, and all they needed was time. And that's why hindsight is a wonderful thing. If I had to do it again, I would have factored in more time for training, but we've got there in the end.
Yeah, so you managed to pause for 4 weeks, but still deliver 8 weeks ahead of schedule. That's impressive.
Yeah, and I have to take my hat off to the team that I've worked with. They're highly invested in making the project successful, and so they've really delivered on those milestones. So I'm lucky. I'm just the guy that got to facilitate it.
I'm sure you've done more than that. So you've talked quite a lot about the benefits, but are there any others that you've seen so far, and how are you going to track the long-term impact of this?
I think the long-term benefit is, the hospital is expanding. We're doubling in size. We're opening a new wing to the hospital, hopefully mid-2027. So the long-term impact of this project is, one of the handbrakes to doing that expansion was being wedded to paper. So the fact now that we've started that digital journey and we're well on the way to it with Personify means that we've been able to, push that expansion plan forward. I'm not saying that was the only thing that was involved, but it was a big part of how could we double the size of the hospital, double the patient numbers, and survive with paper? We couldn't. So that will be a long-term marker of success for the project. I think the fact that when we will open and we'll see patients and things will run smoothly. I think the other long-term marker for success for this project will be it'll enable other digital innovations to happen within the hospital, because we've shown that this sort of small piece of the puzzle, once it's been digitized, has been much more efficient and really successful. So that will increase the confidence, I think, of the organization to go, right, okay, what else can we do out there in a digital way to improve the patient experience and the patient outcomes as they come through the hospital, but to also make us more efficient and less reliant on more cumbersome systems.
And so just finally, you obviously took quite a unique approach in terms of co-designing and implementing Personify, involving consumers and clinical staff.
Mm-hmm.
Were there any lessons from that you've learned that you can share with other hospitals considering a similar digital solution?
The main one is not being afraid to ask questions. We did involve our consumer group, so we were really lucky that we had some local iwi members that were part of the design process, and being confident enough in the project that you're leading to be able to ask people for a warts and all opinion about what they think of it. And the consumers were invaluable in as far as what we thought initially was great. They came back to us and said, yeah, that's really cool, but it doesn't flow quite right. Or, I didn't understand what that question was, so I didn't answer it. And so we were able to take those bits of feedback and tweak the platform and then send it back out to people. And our patients or our consumers felt involved in the process. So for me, I had a greater confidence that when we rolled it out to the wider public, that if it worked for our consumer group, then more than likely it was going to work for our patients as well. And also, it's really important to work collaboratively with all of the areas of the hospital that you're going to be working with, regardless of whether they're directly impacted by the change or not. Because you could have an orderly that will have a little spark of inspiration when they're a test patient on the platform going through the questions and go, oh, well, we would never do that. And so again, it all comes back to having the confidence to be able to ask those questions and then being humble enough to say, yeah, okay, I didn't quite get that right. And so let's change it and make it better.
Those are great words of advice. So thank you for that. And for joining me today. We're going to have to wrap it up there, but it's been such an interesting discussion. And thanks to Personify Care for sponsoring this podcast episode. Mā te wā.